Hello everyone. So today we are going to discuss one PYQ, and here the question is: a child came in due to complaints of diminished vision in dim light, nyctalopia, with the findings are dry eyes and rough corneal surfaces. Asking which deficiency is the child associated with? The answer is straightforward, that is vitamin A deficiency, retinoic acid deficiency. But we'll discuss more of what they have asked. So first of all, let me first tell you how I made the diagnosis, or people made the diagnosis. So as you can see, they have given some ocular findings, some ophthalmological findings, and they are asking you what is the deficiency the child is associated with. So now you can see that they have given something which are putting together. You can easily make the diagnosis of Bitot spot. Bitot spot. Why? The Bitot spot is nothing but it is coming under the spectra of diseases due to vitamin A deficiency is known as xerophthalmia. So xerophthalmia is where the vitamin A deficiency leads to various ocular manifestations. The first manifestation that the child will be presented with is the nyctalopia, that is diminished vision at night, nighttime blindness, nyctalopia, and they have clearly mentioned that diminished vision in the dim light. That is the first symptom of vitamin A deficiency. Okay, Bitot spot is coming 1B, in 1B, BI, that is IB, you can remember it as 1B. Okay, Bitot spot. Now how you made the diagnosis of Bitot spot? Because they have clearly mentioned there's dry eyes and rough corneal surfaces. So dry eyes and foamy appearance are very two important characteristics of Bitot spot. Is it reversible? Obviously it is reversible condition. If you start the patient on vitamin A therapy with appropriate doses, then the chance of reversal is very high and it will get reversed. So what is the treatment? Is vitamin A, and if you remember the dose of vitamin A, less than 6 months, 6 months to 12 months, and more than 12 months. Okay, this is the therapeutic dose I am talking about: 50,000, 1 lakh and 2 lakh. This is therapeutic dose. I'm not talking about the prophylaxis or vitamin A vaccination. So we start with measles at 9 months of age, and then each 6 monthly total 17 lakh dose is given. Started with 1 lakh, and then each 6 months we give 2 lakh doses. That is different. That is prophylaxis, and that is not given in less than 6 months of child. Okay, now this is what is vitamin A deficiency. Also non-ocular manifestation of vitamin A deficiency भी क्या है? आपका phrynoderma or toad-like skin is there ना? That is called phrynoderma. And also if you remember, the phrynoderma is toad-like the papules that will appear on the extensor surface of the elbow, as well as there will be squamous metaplasia, etc. that can happen. Okay, niacin is another vitamin, that is vitamin B3. Why I want to discuss niacin here? Because niacin also produces some ocular manifestation. Okay, but it is not niacin deficiency, it is niacin toxicity. Niacin toxicity can produce macular edema. That's a very important information. Please make a note of it. It will produce macular edema on toxicity. Okay, and also very important, it causes hyperglycemia. Okay, so glucose intolerance is seen with niacin toxicity. That means the diabetic patients whose glucose levels are under control with OHA or insulin, niacin should be very cautiously used there. Okay, so niacin infusion should be very cautiously done in a diabetic patient because it can cause glucose intolerance. Okay, these are very important things, important points you need to remember. Vitamin A toxicity क्या करता है? Retinoic acid. Vitamin A toxicity can lead to acute toxicity of vitamin A, leads to increased intracranial tension. इसको क्या कहते हैं? Pseudotumor cerebri. Is it a tumor? No, it's a pseudotumor cerebri. Just there is increase in intracranial tension, and the patient will be presented with unilateral worst headache. Okay, unilateral headache will be there, and very important, it is also known as idiopathic intracranial hypertension. Can you tell me other causes of pseudotumor cerebri or intracranial hypertension? Yes, you can remember that with the mnemonic TOAD: tetracycline, OCP and obesity, vitamin A toxicity, and D for danazole. Okay, so these are the information you need to remember. Iron and protein deficiency is not directly related to that much ocular manifestation, but yes, iron can be deposited in many of the conditions and making many rings in ophthalmology, like in keratoconus you'll be getting Fleschner ring. Okay, many rings are there, but that is not going to cause any visual problems. What is niacin deficiency going to cause? Niacin deficiency, vitamin B3 deficiency leads to very important Castle's necklace, that is your pellagra. Okay, pellagra. So diarrhea, dermatitis, dementia, and ultimately, if not treated properly, death can happen. That is what is niacin deficiency. Okay, but pellagra is, if they ask pellagra, is because of vitamin B3 deficiency, but there are certain other conditions which can also mimic pellagra, and they are grouped under pellagra-like. Okay, they are also called as pellagra, sorry, yeah, pellagra-like symptoms. Pellagra-like symptoms are seen with एक तो विटामिन B3 या B3 deficiency pellagra. Next, if you remember, number 1 is called heart nerve disease. Heart nerve disease means here what happens, pellagra और विटामिन जो विटामिन B3 है, the precursor is tryptophan. Precursor is tryptophan. Okay, so from tryptophan you will be having, one is your vitamin B3, that is niacin, another is your serotonin, and another is your melatonin. It's not melanin, melatonin. Melanin is from tyrosine. So if you remember that tryptophan से आपका vitamin B3 आ रहा है. So if there is deficiency of tryptophan absorption from the gut, that means the tryptophan is not properly absorbed, that is not available in the so that is also not, due to decreased absorption, it is not available inside, that will cause heart nerve disease. And tryptophan अगर कम है तो B3 भी कम होगा, तो pellagra-like symptoms will be there. Number 2 is carcinoid syndrome. What is carcinoid syndrome? You remember that tryptophan is actually used for the formation of the serotonin, so availability of the tryptophan for vitamin B3 production is decreased. Okay, so that is producing carcinoid syndrome, जहाँ पर B3 कम हो गया और सारा tryptophan is actually going for formation of the serotonin, leading to increased 5-HIAA. Number 3, you have pyridoxine deficiency itself can cause B3 deficiency. You know that inhibits that enzyme kynurenine is something else. And number 5 you have to diet. One is your jowar diet. Jowar also known as sargam, because sargam में क्या है, you have a high dose of leucine is there, and you know that leucine inhibits QPRTase enzyme which decreases the niacin synthesis in jowar. Okay, and another diet that you know is the maize. मेज़ में आपका क्या है, इसमें ल्यूसिन नहीं है, मेज़ और कॉर्न डाइट बोलते हैं, इसमें ल्यूसिन नहीं होता है, बट इसमें नियासिन है इन द फॉर्म ऑफ नियासाइटिन. And when this is present in the form of niacin, that is a bound form of niacin, and that is not active, so it will not be available for the absorption, it will not be available for the action of niacin. So niacin is the bound form. So these are heart nerve disease, carcinoid, B6 deficiency, sorghum diet, and corn diet. These are actually going to cause pellagra-like symptoms. Hope this thing is clear, and whatever I can discuss from this question I have discussed. Thank you. So going to the next question now.